Good morning/afternoon, everyone. Today, I want to talk about one of the most natural and profound experiences in the world: normal vaginal childbirth. For centuries, women have given birth this way, and despite the advancements in medical technology and the increasing prevalence of C-sections, vaginal birth remains the most common and recommended method for most pregnancies. Vaginal childbirth, often referred to as normal birth, is a process that involves the baby being delivered through the birth canal without the need for surgery. It is a remarkable event, one that brings together the physical, emotional, and psychological strength of the mother and the natural progression of labor. Let's explore some key points that help us understand the significance and benefits of this natural childbirth method. Normal childbirth is often referred to as the body's natural way of bringing a baby into the world. It is a biological process that has been occurring for millions of years, long before the advent of modern medicine and technology. This method involves the natural progression of labor, which consists of several key stages: early labor, active labor, delivery, and the birth of the placenta. In the first stage, the cervix begins to soften, dilate, and thin out in preparation for the baby's passage through the birth canal. This phase is usually the longest, and it can take hours or even days, depending on the individual. It is also during this stage that contractions begin, helping the cervix open up to the necessary width for the baby to pass through. The second stage of labor, active labor, involves more intense and frequent contractions, signaling the body is getting closer to the delivery phase. This is when the mother will feel the urge to push. As she pushes, the baby moves through the birth canal, ultimately crowning, the moment when the baby's head becomes visible at the opening of the vagina. In the final stage, the baby is fully delivered, and the placenta follows shortly afterward. The placenta, which has been nourishing the baby throughout pregnancy, detaches from the uterine wall and is expelled. What makes vaginal childbirth particularly significant is the fact that it is a self-regulated natural process where the body works in harmony to bring about the birth. Hormones like oxytocin are released during labor to stimulate contractions, and the baby's own body responds by releasing certain chemicals that help with the birth process. For example, the baby's head helps to mold and adapt to the shape of the birth canal, ensuring a smoother and more efficient delivery. This natural progression not only ensures that the baby is born in the most optimal way possible, but also enables the mother's body to heal gradually and naturally without the need for invasive procedures. In summary, normal vaginal childbirth is a complex, coordinated process between the mother's body and the baby, where the body's natural functions come together to safely bring new life into the world. Vaginal childbirth offers several physical benefits for the mother, which can have a profound impact on her immediate and long-term health. End of footnote. Unlike a caesarean section, which involves surgery and a longer recovery period, vaginal birth tends to have a less invasive impact on the mother's body, allowing for a quicker and less complicated recovery. Quicker recovery time. One of the most significant physical benefits of vaginal childbirth is the generally quicker recovery time. Since vaginal birth does not require an incision or major surgery, women who deliver vaginally can often start moving around and resuming normal activities within hours to days after birth. While some vaginal deliveries may require stitches for tearing or an episiotomy, a small cut made in the perineum, these are generally less invasive and heal more quickly compared to a surgical incision from a C-section. Reduce risk of infection. Vaginal births typically have a lower risk of infections compared to caesarean sections. With a C-section, there is always a risk of infection at the incision site, which may require extended hospitalization, and, in some cases, the need for antibiotics or further procedures. In contrast, Vaginal birth, being a natural process, involves fewer surgical interventions, and the risk of infection is much lower. Less blood loss. Although there is some blood loss during any childbirth, the amount tends to be lower during a vaginal birth compared to a C-section. Caesarean deliveries, being surgical, involve more invasive procedures, which can lead to greater blood loss and a higher chance of requiring a blood transfusion. In a vaginal delivery, the body experiences a more controlled and gradual loss of blood, which typically resolves more quickly, faster. Pelvic floor health. One of the key benefits of vaginal delivery is the exercise it provides for the pelvic floor muscles. The act of pushing during labor works these muscles, which can help them become stronger and more toned. This can contribute to better bladder control and support for the pelvic organs in the long term. Though there may be some temporary stretching and possible pelvic floor trauma during vaginal delivery, the overall benefits are often more favorable than the long-term effects of surgery. Improved circulation. Vaginal birth promotes better circulation as the mother is encouraged to move around and change positions during labor. This helps with the circulation of blood and oxygen to both the mother and the baby. After delivery, moving around is easier, which can also aid in reducing the risk of developing blood clots, a potential concern after a C-section. Absence of scar tissue. In a vaginal birth, there is no large incision or scar tissue formed as in a C-section. Over time, scar tissue can form from surgical cuts, which may lead to complications in future pregnancies, such as uterine rupture or placental issues. Vaginal births avoid this risk, giving the mother more flexibility and options for future pregnancies. Strengthened immune system. Vaginal childbirth triggers a natural release of hormones and bodily processes that help boost the mother's immune system. The stress of labor and delivery activates the body's defense mechanisms, promoting the production of white blood cells and other immune functions. This helps the mother's body fight off infections during the postpartum period. Hormonal benefits. During a vaginal birth, the body releases oxytocin, commonly known as the love hormone. This hormone plays an essential role, not only in helping with contractions, but also in bonding with the baby and facilitating breastfeeding. Oxytocin is beneficial for the mother's emotional and physical well-being, promoting relaxation and reducing stress, which can also aid in the healing process. Improved postpartum experience. After a vaginal delivery, mothers often experience a better overall postpartum experience. The lower risk of surgical complications, quicker recovery time, and fewer physical restrictions all contribute to an easier transition to motherhood. Mothers are typically able to engage in skin-to-skin contact with their baby immediately after birth, which helps with breastfeeding and early bonding. One of the most notable advantages of normal vaginal childbirth is the generally faster recovery time compared to a caesarean section. Vaginal birth is a less invasive procedure, allowing the mother's body to begin healing almost immediately after the delivery. In many cases, women who deliver vaginally can experience a quicker return to their normal routine, both physically and emotionally. Immediate mobility. Unlike a C-section, which involves surgery, a vaginal birth does not require anesthesia or major incisions. As a result, mothers who give birth vaginally can often move around shortly after the delivery. This mobility helps improve circulation, reduces the risk of blood clots, and speeds up the overall recovery process. In contrast, C-section mothers may experience pain and limited movement due to the incision site, which can delay their ability to get up, walk, or care for their baby independently in the first few hours or days postpartum. Shorter hospital stay. Women who have a vaginal delivery typically have a shorter hospital stay, usually ranging from 24 to 48 hours after birth, depending on the individual and the condition of both mother and baby. This is significantly shorter than the hospital stay following a C-section, which can extend up to 3-4 days or more. The quicker discharge allows mothers to return to the comfort of their home environment sooner, where they can focus on bonding with their baby and begin the recovery process in a familiar setting. Reduced need for pain medication. After a vaginal birth, mothers often experience less pain and discomfort compared to those recovering from a C-section. While there may be soreness or discomfort due to vaginal tearing or an episiotomy, this pain is usually less intense than the recovery from abdominal surgery. As a result, many women find they require less pain medication, such as opioids, which can have side effects like drowsiness or constipation. This also means that mothers can stay more alert and engaged in their postpartum care, breastfeeding, and interactions with their newborn. Inspired, faster uterine contraction, and involution. After childbirth, the uterus must return to its pre-pregnancy size through a process called involution. In vaginal birth, the natural contractions that occur during labor, aided by the hormone oxytocin, help the uterus shrink back more efficiently. These contractions can continue in the hours and days following birth, and because the vaginal delivery is a more natural process, the body is often better prepared for this transition. C-sections, on the other hand, may delay uterine involution, requiring additional interventions or medications. Less surgical trauma. While some vaginal deliveries may involve tearing or an episiotomy, these tears usually heal faster than a surgical wound. Reduced risk of post-operative complications. Vaginal birth carries a lower risk of post-operative complications, such as infection, wound dehiscence, wound separation, or blood clots, which are more common after C-sections. The absence of a large incision in vaginal birth reduces the need for vigilant monitoring for complications and the extended use of antibiotics, which is often necessary after surgery. As a result, the recovery process is smoother and quicker for women who deliver vaginally. Easier return to physical activity. Women who deliver vaginally typically find it easier to return to normal physical activity in the weeks following childbirth. Because there are no major incisions to heal, they can gradually ease back into light exercise, stretching, and walking without the restrictions imposed after a C-section. This quicker return to physical activity not only helps improve physical health, but can also boost mental health, as exercise is known to reduce stress and enhance mood. Less risk of long-term recovery issues. While some women may experience pelvic floor issues or urinary incontinence following vaginal birth, the overall risk of long-term complications is typically lower than after a C-section. After a C-section, the body may have to deal with adhesions, scarring, or changes to the abdominal muscles, which can impact future pregnancies and may require additional surgeries or treatments. Vaginal births, by contrast, generally allow women to recover with fewer long-term issues related to surgery. Emotional well-being and psychological benefits. The quicker recovery from vaginal birth has psychological benefits as well. Mothers often feel more in control and empowered by the experience of delivering vaginally, which can contribute to better mental health in the postpartum period. The ability to resume normal activities quickly, including caring for the baby, getting involved in breastfeeding, and bonding, helps new mothers maintain a sense of normalcy and connection with their infant, fostering emotional well-being during the challenging early days. General incidence of postpartum depression. Some studies suggest that women who experience faster recovery after vaginal birth have a lower incidence of postpartum depression. The ability to resume physical activity and bonding with the baby, coupled with a sense of accomplishment from the birth experience, can help improve mood and reduce feelings of stress or sadness. Since C-sections may involve more complex recovery and extended hospital stays, some mothers may feel disconnected or overwhelmed, potentially increasing the risk of postpartum depression. Lower risk of complications. Normal vaginal childbirth generally carries a lower risk of complications for the mother and baby when compared to a cesarean section, C-section. While all forms of childbirth carry some inherent risks, vaginal delivery, being the body's natural process, tends to present fewer immediate and long-term complications for the mother. The absence of major surgical intervention in vaginal births contributes to a smoother recovery and less frequent complications. Let's explore this in more detail. The reduced risk of infection. One of the most significant risks after surgery is infection, especially when an incision is involved. A C-section, being an abdominal surgery, involves cutting through the skin, muscles, and the uterus, which can introduce bacteria into the body and increase the risk of infections. Postpartum infections like endometritis or wound infections are more common after a C-section. Vaginal birth, however, involves fewer invasive interventions, meaning there is less chance of bacterial exposure or surgical site infections, making it a safer option in this regard. Fewer blood clot risks. Women who undergo cesarean sections are at a higher risk of developing blood clots, deep vein thrombosis, or pulmonary embolism, due to the invasive nature of the surgery, the extended period of immobility during recovery, and the use of anesthesia. These clots can travel to the lungs or heart and pose serious health risks. With vaginal birth, recovery is typically faster, allowing mothers to get up and move around sooner, which aids in blood circulation and reduces the risk of clot formation. Less anesthesia-related risk. A C-section requires regional or general anesthesia, which carries certain risks, especially in women with underlying medical conditions. These can include allergic reactions, respiratory complications, and adverse effects on heart rate and blood pressure. Vaginal births, on the other hand, typically involve minimal anesthesia, often just an epidural or local anesthetic for pain management, leading to fewer anesthesia complications. Moreover, women who give birth vaginally are less likely to experience complications related to anesthesia, such as nausea, vomiting, or breathing issues. Reduced risk of injury to organs. Since vaginal birth is a natural process, it does not involve the manipulation or incision of major organs like the bladder, intestines, or uterus, which are involved in a cesarean section. In C-sections, there is a small but real risk of injury to these organs due to the surgical procedure. The risk of damaging the uterus, bladder, or bowel during surgery, although low, is higher in cesarean deliveries compared to vaginal births, which involves no cutting or manipulation of these organs. Lower risk of hemorrhage. While blood loss is a natural part of childbirth, women who undergo cesarean sections tend to experience more significant blood loss than those who deliver vaginally. C-sections are associated with a higher risk of hemorrhage during and after delivery, partly because they involve the incision and the potential for uterine atony, failure of the uterus to contract properly. Vaginal deliveries, on the other hand, typically result in less blood loss because the body's natural mechanisms, like the contraction of the uterus, help stop the bleeding more efficiently. Reduced risk of future pregnancy complications. A history of cesarean section delivery can increase the risk of certain complications in future pregnancies. These include uterine rupture, where the scar from the previous C-section tears during labor, placenta previa, where the placenta blocks the cervix, and placenta accreta, where the placenta grows into the uterine wall. These complications can lead to dangerous outcomes for both the mother and baby. Vaginal births do not carry this risk of scar complications, making them a safer option for future pregnancies. Reduced risk of adhesions. After a cesarean section, Internal scar tissue known as adhesions can form between the organs and tissues in the abdominal cavity. These adhesions can cause chronic pain, digestive issues, or complications in future surgeries. Vaginal births do not involve the abdominal cavity in this way, reducing the likelihood of adhesions developing. Women who deliver vaginally are less likely to experience chronic pain or long-term complications related to internal scarring. Lower risk of postpartum depression. Some studies have suggested that women who undergo cesarean sections may be at a higher risk of developing postpartum depression due to the stress of surgery, longer recovery periods, and the potential for feeling disconnected from the natural birth process. While postpartum depression can occur after any type of childbirth, women who have a vaginal birth and experience a more straightforward recovery are often able to start bonding with their baby sooner, which can contribute to better emotional well-being. The faster return to physical activity and mobility can also reduce the feeling of isolation and help manage mood swings, shorter recovery time, and lower risk of long-term health issues. In addition to the immediate risks, women who have vaginal births face fewer long-term health issues compared to those who have a C-section. For example, cesarean deliveries can increase the risk of pelvic organ prolapse when the bladder, uterus, or rectum drops from their normal position, as the abdominal muscles are cut during the surgery. Births, while they may involve temporary pelvic floor changes, generally have a lower risk of such long-term issues. Natural hormonal regulation. Vaginal birth helps trigger a natural cascade of hormones that support the mother's recovery. Hormones like oxytocin, released during contractions, aid in the contraction of the uterus, helping it return to its normal size. This natural hormonal process helps in controlling bleeding and contributes to faster healing. These hormonal responses are less pronounced in C-sections, where surgical interventions may interfere with the body's natural regulatory processes. Don't start doing whole challenges, June. I've waited too long to be startled. Vaginal birth offers several unique advantages for the baby's health, both immediately after delivery and in the long term. The natural process of childbirth helps prepare the baby for life outside the womb, facilitating important physiological changes that aid their overall health and development. From the stress of labor that promotes lung function to the exposure to beneficial bacteria, vaginal birth provides critical health benefits for newborns that are often not as effectively replicated through cesarean delivery. Lung development and respiratory health. One of the most crucial benefits of vaginal birth for the baby is the stimulation of lung development. As the baby passes through the birth canal, the pressure exerted on the chest helps to expel fluid from the lungs, facilitating the transition to breathing air. This squeezing action encourages the baby's lungs to expand fully and clear excess fluid, which can help prevent respiratory problems after birth. Babies born via C-section, on the other hand, do not experience this natural compression, and they may be at higher risk for respiratory issues like transient tachypnea or respiratory distress syndrome, RDS, especially if delivered early. Exposure to beneficial bacteria. During vaginal delivery, the baby is exposed to the mother's vaginal flora, which helps populate the baby's gut with beneficial bacteria. This early exposure to microbiota is essential for developing a healthy immune system. These bacteria play a critical role in the baby's digestive health, protection from harmful pathogens, and overall immune function. Babies born via C-section, however, miss out on this natural inoculation of beneficial bacteria and may have a higher risk of immune system imbalances and an increased likelihood of developing allergies, asthma, or autoimmune disorders later in life. Higher APGAR scores. APGAR scores are a quick assessment of a newborn's health immediately after birth, measuring heart rate, respiration, muscle tone, reflex response, and skin color. Babies born vaginally tend to have higher APGAR scores, as the natural process of birth helps prepare the body for life outside the womb. The physical stress of labor helps clear the baby's airways and regulate their heart rate and circulation, promoting better overall health in the first few moments of life. In contrast, babies born via C-section may require additional assistance with breathing or other immediate interventions. Lower risk of neonatal intensive care unit (NICU) admission. Babies born vaginally generally have a lower risk of requiring immediate medical intervention, such as admission to the NICU, compared to those born via C-section. The natural progression of labor provides time for the baby to adapt to the birth process, and the gradual pressure through the birth canal helps with respiratory and circulatory adjustments. Caesarean deliveries, especially elective C-sections that are performed before labor begins, can result in more medical challenges at birth, increasing the likelihood of NICU admission for monitoring, respiratory support, or feeding assistance. Stronger immune system. The exposure to beneficial bacteria during vaginal birth not only aids in gut health, but also supports the baby's developing immune system. The immune system is influenced by the early microbiome, which acts as a foundation for the baby's defense against infections and diseases. The transfer of antibodies and immune cells from the mother during vaginal delivery provides the baby with passive immunity in the early days of life. This helps protect against infections until the baby's own immune system becomes fully functional. Better breastfeeding outcomes. Babies born through vaginal delivery are more likely to have smoother breastfeeding experiences. The hormonal cascade that occurs during labor stimulates the mother's production of milk, making it easier for the baby to latch and begin feeding right after birth. This immediate access to breast milk is crucial for the baby's nutrition, immunity, and bonding. Babies born by C-section, on the other hand, may experience delayed breastfeeding due to factors like maternal recovery from surgery, and they may face challenges in establishing a proper latch or feeding routine in the early postpartum hours. Optimal physical development. The physical process of vaginal birth contributes to the baby's physical development. As the baby moves through the birth canal, it must navigate tight spaces and make a series of turns and pushes, which help strengthen muscles and joints, particularly in the neck, shoulders, and back. This process also aids in the development of the baby's skull and brain, as the head can mold to fit through the birth canal. While some degree of molding is normal, it typically resolves in the first few days. C-sections bypass this process, and while this doesn't result in harm, it eliminates the natural physical exercise that contributes to optimal muscular and skeletal development. Faster. Transition to extrauterine life. The natural experience of vaginal birth supports the baby's transition from the intrauterine environment, inside the womb, to the extrauterine environment, outside the womb. The stress of labor helps stimulate the baby's nervous system, leading to the activation of breathing and other vital functions. Additionally, the changes in temperature and light during vaginal birth help the baby adjust to life outside the womb. Babies born by C-section, particularly those who are not in labor beforehand, may require extra assistance as they adjust to their new environment, as their body may not have been fully primed by the labor process. And lower risk of developmental disorders. Some research suggests that babies born via C-section may have a slightly higher risk of developmental issues later in life, including speech delays, learning disabilities, or motor skill problems. While the exact cause of this is still being studied, it is believed that the lack of exposure to the mother's vaginal bacteria, the altered hormonal environment, and the absence of labor may play a role in affecting early neurological development. Babies born vaginally, with all of the natural exposures and processes associated with labor, may have a more favorable outcome in terms of cognitive and motor development. Long-term health benefits. Vaginal birth may offer long-term health benefits for babies, including a lower risk of chronic conditions such as obesity, diabetes, and cardiovascular disease. The gut microbiome, established during vaginal delivery, is thought to play a critical role in metabolism, digestion, and immune regulation, all of which can affect the child's long-term health. Babies born via C-section may face disruptions to their microbiome, which can impact their metabolic and immune systems, potentially increasing the risk of these chronic conditions later in life. Hormonal changes play a crucial role in childbirth, influencing both the mother's and baby's health and recovery. Vaginal childbirth, in particular, triggers a cascade of hormonal responses that support the physiological processes of labor, delivery, and recovery, as well as early bonding and breastfeeding. The natural release of these hormones is critical for a smoother postpartum recovery and for promoting emotional well-being. Let's explore the hormonal benefits of vaginal childbirth in more detail. Oxytocin. The love hormone. Oxytocin is often referred to as the love hormone or the bonding hormone because of its crucial role in promoting bonding between mother and baby. During vaginal childbirth, oxytocin is released in response to uterine contractions, helping to progress labor and facilitate the birth of the baby. After delivery, oxytocin levels continue to rise, encouraging uterine contractions that help the uterus return to its pre-pregnancy size and reduce postpartum bleeding, known as uterine involution. Additionally, oxytocin plays a significant role in fostering the emotional connection between the mother and baby, strengthening maternal attachment. This surge in oxytocin during vaginal birth also helps stimulate the letdown reflex for breastfeeding, facilitating easier and more effective breastfeeding. Endorphins. Endorphins are far more than ecstasy, help to increase pain relief. During labor, the body produces endorphins, which are natural painkillers. These hormones help the mother cope with the intense sensations of labor by providing pain relief and promoting a sense of well-being. The natural production of endorphins during vaginal childbirth is triggered by the stress of contractions and the intense physical effort of labor. These hormones not only help reduce pain, but also elevate mood, giving the mother a sense of accomplishment and relief after delivery. The presence of endorphins during labor can contribute to a more positive emotional experience for the mother, reducing the likelihood of postpartum depression and enhancing emotional resilience in the early postpartum period. Prolactin, the breastfeeding hormone. Higher levels of prolactin encourage early bonding between mother and baby through the act of breastfeeding, which also stimulates further production of milk. The hormonal surge in response to vaginal delivery supports the establishment of a healthy breastfeeding relationship, which benefits both the baby's nutrition and the mother's postpartum health. Adrenaline. Boost of energy and focus. Adrenaline is released during labor, particularly in response to the physical stress and intensity of contractions. This hormone helps to keep the mother focused, energized, and alert during the birthing process. In the early stages of labor, adrenaline prepares the body for action, allowing the mother to push with greater strength and endurance when necessary. After the baby is born, the adrenaline levels drop, and the body transitions into a more relaxed and calm state, facilitated by the subsequent release of oxytocin and endorphins. The natural fluctuation of adrenaline during vaginal childbirth helps the mother remain engaged and active during labor, while also promoting a sense of relief once the birth process is complete. Relaxin, preparing the body for birth. Relaxin is a hormone produced during pregnancy that helps prepare the mother's body for childbirth. It plays a crucial role in softening the cervix and relaxing the ligaments and muscles of the pelvis, allowing for easier passage of the baby through the birth canal. Relaxin's effects are more prominent as labor approaches, helping to loosen the connective tissues and facilitate the physical changes necessary for vaginal birth. After childbirth, relaxin levels begin to decrease, and the body starts the process of returning to its pre-pregnancy state. While the hormone is crucial for facilitating a smooth vaginal birth, its effects also help with postpartum recovery, enabling the body to regain its shape and flexibility more quickly. Cortisol, the stress hormone with protective effects. Cortisol is often known as the stress hormone, but its role in childbirth is essential for both the mother and the baby. During labor, cortisol levels rise, helping the mother manage the physical and emotional stress of childbirth. For the baby, cortisol is important for lung maturation, preparing the baby to breathe air after birth. The baby's body naturally produces cortisol during labor, which helps accelerate lung development and the transition to extrauterine life. While high levels of cortisol are associated with stress, in the context of childbirth, it helps optimize the body's response to labor, improves maternal focus, and aids the newborn's readiness for life outside the womb. Estrogen, supporting labor and recovery. Estrogen is a hormone that rises throughout pregnancy, playing a role in preparing the body for labor. Estrogen levels peak just before labor begins, stimulating the production of oxytocin and prostaglandins, which help trigger contractions and prepare the cervix for dilation. Estrogen also helps to increase blood flow to the uterus and supports the growth of the mammary glands for breastfeeding. After delivery, estrogen levels decrease significantly, and this hormonal shift supports the recovery process, contributing to the reduction of pregnancy fluid retention and helping the uterus return to its normal size. Additionally, the decline in estrogen may promote the production of breast milk by supporting the effects of prolactin. Human chorionic gonadotropin, HCG, aiding pregnancy maintenance. While HCG is typically associated with early pregnancy, its levels begin to drop significantly after childbirth. This hormone plays a role in maintaining the pregnancy, and its levels decrease after the placenta is delivered. The gradual decline of HCG after vaginal delivery allows the body to shift its hormonal environment to support postpartum recovery. As HCG levels decrease, other hormones, such as estrogen and progesterone, adjust to help initiate breastfeeding and prepare the body for the next stages of postpartum healing. The changes in HCG after delivery help to reset the hormonal balance and allow for the body's transition back to normal functioning. Testosterone, enhancing maternal motivation. Although typically associated with male development, testosterone is also present in women and plays a role during pregnancy and childbirth. Testosterone levels are elevated during labor and childbirth, helping to increase the mother's motivation and energy to push during delivery. These elevated levels also contribute to the feelings of empowerment and strength many mothers experience during vaginal childbirth. Additionally, testosterone helps regulate mood and energy levels in the postpartum period, supporting the mother's recovery and her ability to care for the newborn. Prostaglandins, facilitating labor. Prostaglandins are hormones that play a key role in the onset and progression of labor. These hormones help soften and dilate the cervix, preparing it for delivery, and also stimulate uterine contractions. Prostaglandins are produced naturally in response to labor, and their levels increase as labor progresses, promoting the rhythmic contractions that help push the baby through the birth canal. Prostaglandins are also involved in reducing postpartum bleeding by aiding in the contraction of blood vessels in the uterus. Their role in initiating and sustaining labor ensures that vaginal birth can progress effectively and safely. Encourages breastfeeding. After vaginal birth, the hormonal changes and bonding experiences between mother and baby promote breastfeeding. Early skin-to-skin contact, which is more feasible after vaginal delivery, is known to boost breastfeeding success. Increased bonding. Bonding between blood and sperm bounces better through old age than blood and skin contact between mother and child, facilitating emotional bonding and helping the baby adjust to life outside the womb. Lower cost. Vaginal birth is generally less expensive than a C-section, which involves surgery, longer hospital stays, and higher medical costs. This makes vaginal birth a more cost-effective option for many families. Empowerment and control. Many women find vaginal birth to be an empowering experience. While the pain can be intense, many women appreciate the feeling of control and accomplishment that comes with the natural birthing process.